there are 5 to 6 panels of hepatitis and 3 panels of jaundice. What are panels? Panels mean the status of the serology markers of patients, namely hepatitis B surface antigen or envelope antigen or core antigen or presence of antibody. So the various combinations of hepatitis B surface antigen or core antigen or envelope antigen or presence or absence of antibodies, you need to know the significance of presence and significance of absence of various markers or various antigens with their respective antibodies in serum, and you need to answer accordingly with a brief explanation. Okay? Ki shona jacche na? Ki? So this is your first panel. Panel for serological diagnosis of hepatitis B. Okay? So in the left column there are markers and the result are encrypted in the right column. So first panel shows that HBsAg present for more than 6 months. HBeAntigen present, anti-HBc IgM is absent, anti-HBc IgG is present, anti-HBe is anti-HBe is absent and anti-HBs is absent. So what is your diagnosis and state reasons? So what is the nature of hepatitis B virus? Is it a DNA virus or a RNA virus? So all the hepatitis virus are RNA virus except hepatitis B virus, which is a DNA virus. Okay? So chiefly the main 3 component or main 3 enzyme of the virus are, the main antigen is Australia antigen or surface antigen. Okay, HBsAg. Next one is e-antigen and core C antigen, envelope antigen E. Okay. So presence of HBsAg for more than 6 months. So that means this is a case of chronic hepatitis. So the serology status says that HBsAg present for more than 6 months. So it is a chronic hepatitis case. The person is probably a carrier of hepatitis B virus, and the next step is to diagnose whether the person or carrier is on high infective status or low infective status. So alongside with presence of hepatitis B surface antigen, there is also presence of hepatitis B e-antigen that is also present, and anti-HBc IgG is present. So what is your diagnosis? This is a case of chronic hepatitis and the person is hepatitis B carrier with high infective rate. Okay? So this is your explanation. So 2 plus 2 marks. Very short diagnosis and very short description or explanation. So chronic hepatitis evident from presence of 6 months. High infective state is evident with presence of e antigen present and absence of anti-HBe. Okay? Next. ওইখানে আসতে হবে। আচ্ছা ঠিক আছে এসছে। আচ্ছা ঠিক আছে। So next panel is again, second panel is hepatitis, HBsAg antigen present for more than 6 months. Okay, HBe antigen is absent in this case. Anti-HBc IgM is negative. HBe antigen is also negative, unlike other case. Anti-HBc IgG is positive, anti-HBe is positive, and anti-HBs is negative. So, from the presence of Australia antigen for more than 6 months, it is evident that this is a case of also chronic hepatitis, and the person is chronic carrier or hepatitis B carrier, and the infective rate is low. Why low? Because absence of HBeAg and presence of anti-HBc IgG. So the protective antigen against the infectivity of the virus is present, and anti-HBe is also present. So what is your diagnosis? This is a case of chronic hepatitis. The person is carrier with low infective rate. Okay, clear? The first panel, chronic active hepatitis with high infective rate of the carrier. So the next one is, so the third panel is HBsAg antigen negative, HBe antigen negative, anti-HBc IgM positive, anti-HBc IgG is negative, anti-HBe positive, and anti-HBs positive. So the presence of antibody here is evident and surpasses the absence of surface antigen and envelope antigen. So what does it mean? So this is a case of recovery, or the patient is immune, carrying immunity or having immunity against hepatitis B virus, but the patient is not having any active infection. So what is your diagnosis? The patient is probably having past hepatitis B infection, and the patient is having immunity by the presence of antibodies. Okay? The fourth one is ambiguous. It won't be asked in your exam. It also shows the presence of anti-HBc IgM, just the recovery phase. So the IgM antibody, that is the acute response against the antigen, this is only present, but anti-HBc IgG, anti-HBe, anti-HBs all are absent. HBsAg and HBeAg all are absent or negative. So this is also a diagnosis of acute? No, hepatitis, acute hepatitis hole antigen gulo present thakto. Post recovery, ঠিক আছে, post recovery phase or convalescent phase, এটা তোদের দেবে না, এটা একটু ডিফিকাল্ট আছে। 4 নম্বর প্যানেলটা তোদের দেবে না, রাশিদা বলে দিয়েছে। পরেরটা যা, পরেরটা। এবার দেখ এই প্যানেলে কি বলছে, HBsAg পজিটিভ, HBe অ্যান্টিজেন, অ্যান্টিজেন পজিটিভ দুটোই আছে, HBsAg and HBeAg both are positive, anti-HBc IgM positive, anti-HBc IgG are negative, anti-HBe negative, anti-HBs are negative. So all the antigens are positive. So this is a case of active infection. Okay, active infection denotes the presence of antigen, but the active infection or the acute hepatitis doesn't allow to develop the antibodies till date in the serum, to presence in the serum. So this is a case of active infection of hepatitis B, because presence of antigen, both HBsAg and both HBeAg, but absence of anti-HBc IgG, that is long-term antibody response against hepatitis B, anti-HBe, anti-HBs. All are negative, but the antigens are positive. All antigens are positive, and IgM also positive. IgM positive means that is the acute phase. So IgM and IgG antibody difference key. IgM antibody is the first antibody to be appear in serum against any virus or against any antigen. The hyperacute response of the antibody is depicted by the presence or appearance of IgGM, okay, immunoglobulin M, and the chronicity of that infection or the late response of our immunity system to that virus or antigen is depicted by the presence of antibody IgG, okay. So what is your diagnosis in this panel? Active hepatitis, okay. State reason, you will give reasons that hepatitis antigens are present, hyperacute response of the antibody, that is IgM, is also present, but IgG and all other antibodies are absent. So this is a case of active infection, active hepatitis infection. And panel this is last for the hepatitis B. So in the last panel, presence of HBsAg absent, HBeAg absent, anti-HBc IgM also negative, absent, anti-HBc IgG negative, anti-HBe negative, anti-HBs positive. So what is your diagnosis? This is a case of active infection or acute infection or chronic infection or carrier or immune status, high immune status of the carrier. What is this? What is your diagnosis? Immune. So this is not a case of active infection. This is denotes a past hepatitis B infection and patient is having immunity against hepatitis B antigen. Okay? তাহলে বোঝা যাবে তো যদি পাঁচটা একটা প্যানেলের মধ্যে if a panel enlisted 6 parameters like HBsAg, HBeAg, HBcAg, anti-HBc IgG, anti-HBc IgM, 2 to 3 antigen or antibody are strikingly important and need to be carefully observed by you. একটা প্যানেলের মধ্যে যদি 6টা এন্টিটি থাকে, 6টার মধ্যে 2টো বা 3টে নেমলি HBsAg, HBeAg, anti-HBs and anti-HBcAg IgM, এই চারটে সবথেকে বেশি ইম্পর্টেন্ট। এদের পারমুটেশন কম্বিনেশন করে তোকে দেখতে হবে বা অ্যান্সার দিতে হবে যে whether the case is acute, whether the case is chronic, whether the carrier is carrying high infectivity status or the carrier is having low infective status. বোঝা গেল everybody? So these panels, the fourth panel won't be asked in your exam, but 1, 2, 3, 5 and 6, these 5 panels will be asked in your practical examination. So don't get confused by the load of information, just give focus to the striking and the most important entities, namely HBsAg or surface antigen, most evident Australian antigen, or HBe antigen, next anti-HBc IgM and anti-HBs IgG or IgM, anti-HBs antibody. Okay, next jaundice. Panel for diagnosis of jaundice. So perhaps I have taken the class of jaundice theory, chalk and talk. So I have explained the bilirubin metabolism and the nature of the jaundices, and in my last part of the lecture I thoroughly make a table that the differences of serum parameters and the urine parameters and the stool parameters of the patient, and along with the clinical sides, symptoms and signs, we need to focus on the serum parameters of bilirubin, the nature of the bilirubin, whichever is increased, whether it is direct or conjugated or indirect or unconjugated. Next, the liver enzymes, whether it is marginally increased or whether it is hugely increased. The presence of alkaline phosphatase, whether it is within normal limit or whether it is heavily increased. And the urine and stool color, presence of urobilinogen and bile pigment, and the color of the feces and the presence or absence of stercobilin. So here are also panels for 3 types of jaundice. One is pre-hepatic or hemolytic jaundice. Next is hepatic jaundice and post-hepatic or obstructive jaundice. So 3 panels will be there in your exams. 1 or 2 panels will be asked for each batch. So this is a concept. So you need to build the concept and then answer accordingly. Okay. First, from the first panel, what we can see, total bilirubin is, total bilirubin is 8.9 milligram per cent. Unconjugated bilirubin, spelling mistake ache, unconjugated bilirubin 3.4 milligram per cent, conjugated bilirubin 5.5 milligram per cent. SGPT or alanine transaminase is 925 international unit, that is hugely increased. SGOT or aspartate transaminase is 723 international unit. ALP or alkaline phosphatase is 167. Gamma GT 56. Prothom mean time normal. Next, AG ratio mane ki? Albumin globulin ratio normal. And coming to the urine examination, color প্রথমেই বলে দিবি না, সবটা দেখ। তাহলে bile pigment present, bile salt present, urobilinogen is also normal. Stool examination এ কি হচ্ছে? Color pale and stercobilin decreased. What is your diagnosis? State reason. What is your diagnosis? This is not post-hepatic jaundice because hepatic jaundice, because I told you earlier that hepatic jaundice is the clinical features as well as the blood and urine stool parameters are combination of both hemolytic jaundice and obstructive jaundice. So the main striking feature that you need to focus in liver function test is the hugely increased ekdom SGPT and SGOT. So this is a case of hepatic jaundice, and there is necrosis and degeneration of the hepatocyte or conjugation mechanism. So the total bilirubin raised or increased hyperbilirubinemia is attributed to increase in both conjugated and কথা বলছিস কেন তোরা? কথা বলিস না। Conjugated and unconjugated bilirubin. Okay, both are increased, but strikingly increased portion is the overwhelming increase in SGPT and SGOT. Okay, so this is a case of hepatic jaundice. What is the causes of hepatic jaundice? কি কি বলবি? যদি জিজ্ঞেস করে তারপরে নেক্সট কোশ্চেনে এক্সামিনার ফার্স্ট কি বলবি? অবস্ট্রাকশন কেন শুরুতে বলবি? অবস্ট্রাকশন বলবে যে কি অবস্ট্রাকশন, তখন তোকে বলতে হবে ইন্ট্রাহেপাটিক অবস্ট্রাকশন, ইন্ট্রাহেপাটিক কোলেস্টেসিস। ফার্স্টে সোজা কথা সোজাভাবে অ্যান্সার দিতে হবে। ভাইরাল হেপাটাইটিস, ঠিক আছে, ড্রাগ অর টক্সিক হেপাটাইটিস। তারপরে কি বলবি? হচ্ছে সিরোসিস, তাই তো? যখনই সিরোসিস বলবি তখনই তোকে সিরোসিসের কোশ্চেন জিজ্ঞেস করবে, টাইপ কি কি সিরোসিস হয়, কিরকম নোডিউল হয়, কি কি ইটিওলজি আছে, অনেকগুলো কোশ্চেন তুই ইনভাইট করতে পারবি। তাহলে মোস্ট কমন কজ অফ হেপাটিক জন্ডিস ফার্স্টে বলতে হবে ভাইরাল হেপাটাইটিস, ড্রাগ ইনডিউসড হেপাটাইটিস, নেক্সট সিরোসিস। ওকে, সেটা অ্যালকোহলিক সিরোসিস হতে পারে, নাও হতে পারে, কিন্তু সিরোসিস বলতে হবে, হেপাটিক জন্ডিস। আর আমি যদি ইন্ট্রা হেপাটিক কোলেস্টেসিস বলি সেটা অনেক কঠিন হয়ে যাবে, হয় অবশ্যই, হ্যাঁ, বা টিউমার, হেপাটোসেলুলার কার্সিনোমা, সেখানেও জন্ডিস হতে পারে, কিন্তু সেইগুলো আরো ডিফিকাল্ট অ্যান্সার হবে ক্রস কোশ্চেনে যখন এক্সামিনার যাবে। তাই জন্য সোজা কথা আমি সোজাভাবে অ্যান্সার দেব। এইবার দেখ, প্যানেল ফর ডায়াগনোসিস অফ জন্ডিস, টোটাল বিলিরুবিন কত? 4.9 মিলিগ্রাম%। তার মধ্যে আনকনজুগেটেড কি 4 মিলিগ্রাম%, কনজুগেটেড 0.9 মিলিগ্রাম%। তাহলে এই তিনটে দেখেই লিখে দিবি, ঠিক আছে? আনকনজুগেটেড বা হিমোলিটিক জন্ডিস, SGPT 35, SGOT 30, both are normal. ALP is also within normal range 56, gamma GT 20 international unit, প্রথম মিন টাইম নর্মাল, AG রেশিও নর্মাল। আচ্ছা, একটা কারেকশন করি, উপরে যা। এখানে আমরা বলেছি ইন হেপাটিক জন্ডিস প্রথম মিন টাইম is normal, but প্রথম মিন টাইম may be abnormal or increased because all the clotting factors or coagulation factors of intrinsic pathway synthesized in liver. So in case of advanced cases of hepatic jaundice or advanced hepatocellular necrosis, the factors like 2, 7, 9, 10 are production decreased to that much extent, so PT, APDT and INR will be increased. Okay, so in hepatic jaundice PT may be normal in early cases but abnormal or increased in late advanced cases. Okay, ja porettate ja. So total bilirubin, the 4.9 milligram% and more than 85% of this total bilirubin is unconjugated type. So coming to the urine examination, urine is, so bile pigment, bile salt are absent and urobilinogen is increased. And stool examination, color of the stool is yellow and stercobilin, the portion of stercobilin is increased. So yellow color of the stool is attributed to the presence of stercobilinogen, and on oxidation with air it converts to stercobilin. So what is your diagnosis? Hemolytic jaundice or pre-hepatic jaundice. State reason, because তাহলে কি reason দিবি? Unconjugated. So the increase of the bilirubin is attributed to the production of the bilirubin that surpasses, বলতো ইন্দ্রাক্ষীকে ক্লাস নিচ্ছে স্যার, that surpasses the capacity of conjugation of the liver. So this is a case of prehepatic jaundice or hemolytic jaundice. So what are the common causes of hemolytic jaundice or prehepatic jaundice? Common causes, hemoglobinopathies. Very good, হ্যাঁ এইভাবে বলতে হবে hemoglobinopathies। তাহলে পরের কোশ্চেন বলবে what are the hemoglobinopathies, do you know? তখন বলতে হবে থ্যালাসেমিয়া বলতে হবে, G6PD ডেফিসিয়েন্সি বলতে হবে, সিকেল সেল অ্যানিমিয়া বলতে পারিস, ঠিক আছে? তারপরে হচ্ছে আদার হিমোগ্লোবিনোপ্যাথিস হতে পারে। তাহলে হিমোগ্লোবিন ব্রেকডাউন বেশি হচ্ছে, the more the breakdown, more the unconjugated portion of the bilirubin will be rise. So the case of prehepatic jaundice or hemolytic jaundice will arrive. Okay, last একটা যা। So this is the last panel. Total bilirubin is 10 milligram%, unconjugated 1.2, conjugated 8.8 milligram%. So more than 85% of the total bilirubin is direct type or conjugated type. So this is a case of post-hepatic. আরো দেখতে হবে বাকিগুলো, SGPT, SGOT, the liver enzymes, the metabolic activity are assessed by these two enzymes are not that much increased like in hepatic case. Okay, alkaline phosphatase, it is increased. Gamma GT, it is also marginally increased. Prothrombin time prolonged. AG ratio normal. Okay. Urine examination, color deep yellow, mustard color urine, because the presence of bile pigment and bile salt, but absence of urobilinogen, okay, or decreased. Stool examination, patient will have clay color stool due to absence of stercobilin. So certainly there is an obstruction to the pathway of conjugated bile, conjugated bilirubin through bile. So the obstruction will be either in the common bile duct, or the obstruction will be in the cystic duct. Obstruction will be due to stone more commonly. Less commonly in aged patient will be growth or tumor that compresses or that exerts the compressive effect or obstructive effect to the outflow of the bile. Okay, so this is the case of obstructive jaundice, and you need to state your reason. So what are the common causes of obstructive jaundice? Tale ki bolbi? First common things happens commonly. First tale ki bolbi? First stone, cholelithiasis, choledocholithiasis, stone in gallbladder or stone in common bile duct. Next ki bolbo? Infection hote pare sclerosing cholangitis, or the bile duct will be hugely inflamed and the sclerosing, that means the lumen of the bile duct is getting narrowed down due to fibrosis, extensive fibrosis. Next is tumor of the bile duct or tumor of the other adjacent organ that exerts compressive effect to the bile duct, like carcinoma head of the pancreas, or carcinoma at the second part of duodenum, or carcinoma of the ampulla of Vater. Okay, so what will be the cause? The main effect or output will be the obstruction of the exit way of the bile or the conjugated bilirubin as bile. So common thing happens commonly. So you need to answer accordingly, the common things first, then the less common and the rare thing at the last. Okay, so panel of post-hepatic or obstructive jaundice will be like this thing. Any confusion, any question from these 6 and 6 plus 3, 9 panels, 6 from hepatitis and 3 from jaundice. It will be asked invariably in your exam, okay? Just use your concept, don't get carried out by previous batch or don't get carried out by your fellow helpful batchmate or colleagues. Just use your own logic, use your own mathematics and then only answer. Okay, if you miss the diagnosis, then you won't get any number for the reasons or your explanation. And the crossing will be over. The cross examination will be over also. So very minutely, I am requesting you, go through the panels in a calm mind, go through the parameters and then deduce the diagnosis and write down it, and very short description, not lengthy description or lengthy explanation, but very short description to the examiner. Okay.